nasal allergies, allergic rhinitis, hay fever, seasonal allergies. What are these? This is a common question that I get. Many people have a hard time sorting out through these symptoms and knowing when it is time to see a doctor or a specialist in order to treat these chronic problems. I am Dr. Sitesh Roy, your allergist, immunologist and asthma specialist. We breathe 10,000 liters of air every single day. That's required for human survival by an adult. And every ml of these 10,000 liters has to pass through our nose and our nasal passages to reach our lungs. The nose performs amazing activities like warming the air, humidifying the air, and also filtering the air so that whatever reaches our lungs is clean and usable. Now imagine that through this air, every single known and unknown indoor pollutant and outdoor pollutant also has the potential of passing through our noses. Amongst the indoor pollutants, we can think of cigarette smoke, burning incense sticks. We can think of air deodorants, sprays, different kind of cleaning chemicals. There are a lot of substances which we would classify as irritants, which can bother any and everyone. When we think of outdoor pollutants, we think of dust, smoke, construction dust, diesel particles, exhaust from different places. And clearly all of these can bother any live human being. But when we talk about allergies, we are talking about naturally found proteins and glycoproteins, which in the indoor environment would include like house dust mite particles, cockroach particles, pet dander, things like mold. And when we talk of the outdoor environment, we would talk about pollen that can come from trees, grasses, weeds. There are many sources for it. And along with it, we would also expect some outdoor molds which specifically stay in the external environment outside our homes. Now, why do we call these allergies or allergens? Because they don't seem to bother everyone, but the reality is that nasal allergies and ocular allergies that affect the eye affect almost 20% of the world's population, including in our country of India. So in allergic rhinitis, imagine that a dust mite particle, which has been around us since thousands of years, gets into a person's nose, and the person's nose has two choices: either to ignore it or tolerate it, or to fight it and mount a very strong reaction against it. The first one would lead to a person being not allergic to the house dust mite, and the second response would make them allergic to it. So this kind of an overzealous response to a naturally acquired or existing protein in our environment is essentially an allergy. Now these allergies can manifest or present as sneezing, runny nose, congested or blocked nose, itchy nose, and along with this, if a person also has ocular allergies, then they may develop itchy, watery red eyes, sometimes swollen eyes. Now people think that allergies, you take a pill, you take a spray and you're fine, but allergies go beyond that for those who have moderate to severe allergies. In moderate to severe allergies, a person can feel fatigue, tiredness, lack of focus and attention in what they are doing. They can also feel that they have irritability, they have anxiety sometimes due to very severe allergies. Allergies also can lead to recurrent sinus infections, they can lead to ear infections, and if persisting for a long time, allergic rhinitis or nasal allergies can also convert into asthma. And when we look at other effects like affecting the dentition, the oral health of the person because they are snoring, or their mouth breathing, allergies really have a very wide range of symptoms that they can cause in a human being. And the problem is this can start in infancy and continue a whole lifetime. It can also begin in the teenage years, it can begin in adulthood, it can even begin in a senior citizen for all that we know. So allergies really don't have a typical timeline. They can develop in perfectly healthy individuals at any point in their life. So when we look at how do we diagnose these allergies, the only way to diagnose is that you see a specialist, an allergist immunologist, and they do something called an allergy skin test. And in this we can specifically find out which substances you have developed a specific IgE antibody to and are reacting to within 20 minutes, possibly 15 to 20 minutes. So it's a rapid test, an easy test. You do have to stop any anti-allergic medicines before doing it. And then the option for those who do not want to do a skin test is a blood test. But remember that the blood test can also pick up a lot of non-existing or non-clinically relevant allergies called false positives. But the blood tests are also very accurate and very successful in helping us identify the triggers. Once the triggers are identified, the question comes up, how do we treat allergies? The treatment of allergies can be divided into basically 3 or 4 parts. The first part is allergen avoidance. So if you know you have an allergy to roaches, then you would do everything you can to try to keep roaches out of the house and also not bring roach allergens into your home on your footwear or something like that. And this your allergist immunologist will guide you on if that's what your allergy is. Similarly, for house dust mite there are precautions, for pet dander there are precautions, for mold there are precautions. The next step is the right kind of medications. So there are safe non-drowsy medications, there are safe nasal sprays, and several other such treatments by which the allergic rhinitis can be controlled. The next step is realizing that allergies are a chronic disease. They may sometimes get worse seasonally, but in many people it can be a year-round problem. And once we know that, then the final step is something called immunotherapy, by which you can be potentially permanently desensitized or tolerized to the allergen. But there are many people who do this incorrectly for very short durations of time and hence find it to be ineffective. So done in the hands of a trained allergist immunologist, you can expect very good results with allergen immunotherapy. So friends, that is a quick rundown in brief as I could. This is actually a very large topic. But remember that people who have allergies also get affected by all the non-allergic triggers that I mentioned in the beginning of my talk. And so it becomes important to control whatever indoor or outdoor pollutants we can when it is potentially possible, along with controlling the allergies. And hence, with all this information, I hope you live a healthy, happy life, breathe freely, and are in full control and eventually even are able to cure your allergies. Till the next video, take care, stay blessed. God bless us all.